Good morning, Team Redstone. It's Colonel Smith and Colonel Meador once again with your Team Redstone Town Hall. Today I have with me Sherry Kane from our FMWR and Child Development Services, as well as, of course, Sergeant Major Jimenez. We are now on our fourth Team Redstone resident town hall, specifically focused on COVID-19, but answering your questions regarding Redstone Arsenal and Team Redstone. We will make this as of today, and I guess really last week when we did this last Thursday, we're doing this again Thursday Thursday at 9, and we will continue to do these Thursdays at 9 for the foreseeable future so we can answer your questions as Redstone Arsenal in the Tennessee Valley continue to combat COVID-19. This morning, I'll start with just a quick statement, and that being that, as you know, Redstone Arsenal continues to assess the threat to our local area and to the installation, and we continue to adjust or take precautions to adjust how you interact with Redstone Arsenal and how we continue to take care of the Redstone workforce. Again, the most important thing that any of us can do to prevent or protect the workforce here at Redstone Arsenal is to look at ourselves and ask ourselves how we are doing complying with the stay-at-home order, as well as our personal hygiene, staying at home if we're sick, maintaining our social distance, and then staying at home or minimizing how much we travel. And I am again challenging you to make sure that you are maintaining personal accountability in this effort. And with each day that we stay home and each day that we limit our contact with others, the better or the more likely we will be able to combat COVID-19 and beat this infection. I'm going to answer a couple questions this morning. I'll cover on a couple things that just initially came out, and then I'll hand it over to Colonel Meador to talk about Fox Army Health Center, and then on to Sergeant Major. So the first question is, what are rules for masks on the installation? It appears that some people are using them and some are not. So the Department of Defense guidance that came out at the beginning of the week specifically stated that individuals on a DoD installation should be prepared to wear a cloth mask if they are unable to maintain 6 feet of social distancing. It doesn't require everyone to wear the mask at all times. What it requires, or to wear a cloth covering at all times, what it requires or encourages is it encourages the use of a mask when you, an individual, cannot maintain 6 feet of social distancing. We are encouraging everyone who can't maintain that social distance to have a cloth face covering. I have one in my pocket every day. And when I come in contact or can't maintain that social distance, I put it on. I encourage you to do the same thing. At the same time, I acknowledge that some of us are comfortable wearing the mask all day long, and that makes us individually feel better. However, there are those that until they approach a 6-foot distance, they're not going to put the mask on. And I encourage all of us to take care of ourselves, make sure we're compliant, and allow others to do the same. The next question is, my child does not normally attend the CDC, but I need childcare while I'm at work. Since I've been identified as mission essential by my organization, can I use the CDC? Well, I will tell you that it is not a good idea to bring your child to work today and try to go to the CDC if you're mission essential. What I will tell you is that if you contact me or you contact Parent Central Services at MWR and you have a mission essential designation by your tenant organization commander, then we will make all effort to make room in our Child Development Center for you and your child, or for your child particularly. We are opening it up to mission essential personnel. Now, I'm going to caution you, though. we're opening it up for mission essential personnel while we are at the current health protection condition. When we relax the standards, we will return to normal operations, and those patrons who previously used and had a spot at the Child Development Center, we will return that position back to them as they begin to come back to work. So we are happy to provide that service to mission essential parents for the time being. At the end of this, we will go back to normal operations, and you'll lose your opportunity to use the CDC. But we hope you enjoy and benefit from using it while we are able to offer it to you. The next question: is there any place on Redstone Arsenal to get a face mask? If masks are recommended for everyone, will they be made available? We cannot complain about people not wearing them in public areas, the commissary and the PX, if we're not making masks available to our people. Specifically, I'll cover that, is Redstone Arsenal believes that you as individuals will have the ability to maintain your 6 feet of social distancing. That makes absolute sense to us. The DoD directive or policy specifically states that unless you come within 6 feet of one another, it's not necessary to put a mask on. So at this time, Redstone Arsenal is not making it mandatory to wear it to access the installation. And at the same time, we're not issuing them. For those people who are working in a tenant organization who are required to work within 6 feet of one another, you can be assured that if you work for Redstone Arsenal, the Garrison, that we are issuing masks and the appropriate PPE to those individuals that have to work within 6 feet of one another or have a specific task to do that requires them to have personal protective equipment. But I don't expect that we will be issuing masks to the general public. What we rely on is the DoD directive that says that each person should be able to come up with their own cloth face covering as long as it's in good taste, and they should be able to wear it anytime they're within 6 feet of one another. And we look to you to enforce that internally and make sure you're following the directive. Now I'm going to take a quick break, and I'm going to turn it over to Colonel Meador, let him handle a few questions this morning.
All right, thank you. Good morning, Team Redstone, families and friends. As always, it's a pleasure to address you with updates and field some questions about Fox Army Health Center. Happy to be with you and again talk through some updates here with respect to Fox. Happy to tell you we remain open for you to serve you, especially for acute appointments. We are seeing, as you might imagine, things other than COVID-19. The flu is still in its last remnants for the season, and colds as well. So as you have certain instances where you need to see one of us or a medical provider, please do remember you can access those providers and establish appointments as per the normal means, TRICARE online or call in. And we look forward to bringing you in same day or next day based on the need you might have. Our pharmacy drive-through pharmacy remains up and operational. I would like to talk to you about a new process that we're going to begin tomorrow. But before I do that, I just want to make sure you know that all your refills for the drive-through pharmacy remain as they have been in the past couple of weeks for drive-through refills with our pharmacy. The new process I'd like to talk to you about is new prescription pickups, as we will endeavor starting tomorrow to push all pharmacy operations outside. We'll begin this process now for new prescription pickups in the same line. And indulge me a minute here as I walk through that process with you. For new prescription pickups, again, that process starts tomorrow. We ask that you enter the same pharmacy line drive-through that you do for refills. When you come up to the first individual, you're going to be asked what type of pickup is this. And when you address the individual that this is a new prescription, you're going to be asked, do you have a hard copy, or is it a provider call-in or fax? Based on that, we're going to ask you if we could have a copy of the hard copy. We're going to put that in a plastic bag to, again, prevent the transmission of any germs or what have you, your hard copy, if that's what you bring over there. And then the second thing we're going to ask you is if we can offer to you to either drop it off with us and pick it up the next day, or depending on how much time you have or based on the need you have for that particular medication, you have the option to pull around and park on the pharmacy entrance side of the facility where we will fill the prescription. When you first see that individual, when you initially drive up and make it aware to them that you do have a new prescription, we're going to get a piece of paper where we take down your phone number, your vehicle make and model, and in the option where you want to wait and wait in the parking lot, we're going to text you or call you when your medication is ready. We're going to bring it out to you in your vehicle. And that's why we need to take down that information so we know where we're bringing that medication to. So again, if you decide to, with your new prescription, to wait, we're going to ask you to go through the line, pull back around over to the pharmacy side of the building and park and wait. Again, assuming you have some time where you can wait, we estimate 30 minutes. And when it's ready, we're going to text you or call you. And again, we're going to bring that medication out to your vehicle. And that process starts tomorrow. Ask for your patience in that particular scenario. If it is a new prescription, tomorrow will be our first day. Might be a couple of kinks we're trying to work out with that, but we expect the process after a few iterations to be running quite smoothly. That is in an effort to bring more foot traffic outside of the building. We're trying to observe as best we can the governor's stay-at-home order. In essence, with that is we execute actions that we think can protect people in a better manner. That's one way we're going to do that. Now, having said that, for those of you that are coming in for appointments, and remember again, we will be screening you out front. We're going to take your temperature. We're going to ask you some questions to see if there's something we may need to look further into. As always, for whatever reason you came to Fox for whatever service you needed, you're going to get that. It just may be in a different aspect of the facility than what you were expecting. But again, you're going to get the service or the medication that you came there to receive. And we look forward to seeing you there. A couple of other updates here as I go through my notes. Social media for Fox Army Health Center, we ask you to follow us on Facebook. We also ask that you keep up to date with our Army.mil, redstone.amed.army.mil. For Fox Army Health Center, we have a COVID tab there. The reason we ask for that is during inclement weather, we will have to close our pharmacy operations outside. As you might imagine, lightning, thunder, heavy rain makes it very difficult to provide you your medications when there's a lot of rain coming down. And remember, too, I have to protect my staff members if we've got thunder, lightning in the area. We have had that a couple of times already. And it doesn't mean we'll be closed for the whole day. Great example was yesterday where we initially thought we'd be closed for a couple hours. We ended up being open because it wasn't raining. Now we endeavor to keep our Facebook page and our Army.mil webpage updated as real time as possible. So we ask that you follow us. Search for us on Facebook. Also has our diagrams if you're not familiar with the loop with which to use to pick up your medications. And do look at that. And as I said, we'll update that as much as possible. A couple of questions that we've received of late. I'm happy to answer. Very good questions, by the way. One in regard to testing. It says, will Fox Army Health Center be able to test for COVID-19 antibodies to see if people who may have had COVID-19 are now recovered and able to get to work? As of now, MTFs in the Department of the Army do not have that capability. It doesn't mean we won't. I can tell you there are some rapid fielding initiatives ongoing for military treatment facilities for testing equipment. That capability has yet to make itself available to us. That's not to say it won't. Currently, we do not have that. That's not to say commercially it's not available to some facilities. We expect that to sometime in the near future to happen, but currently, in what's being presented to me at Fox Army Health Center, that capability does not exist. That said, testing is still something we are undergoing and executing at Fox Army Health Center. Again, that's through a deliberate screening process. If a provider sees you and indicates that a test is required, we certainly do that. Other instances have arisen where Fox Army Health Center will reach out to you and let you know we'd like to test you. That has taken place, and that process has been a good one. efficient. We have times, place, dates, locations that we establish that with those individuals we reach out to. And we have a good testing capability where we get results within 24 hours for those that we feel the need is justified. Another good question here is, will Fox Army Health Center consider having weekend hours during this pandemic? I will tell you, currently the demand has not warranted our study of this. I can tell you if for whatever reason on our Monday through Friday hours, if it becomes either not doable or where a weekend time is something that would alleviate, again, an overabundance of customers, we will certainly look at that. I can tell you currently the demand signal we have Monday through Friday, our business hours are meeting this demand. That's not to say that, again, if in the future we have a lot of demand, that's not an option. But currently, our study remains every day. Who we're seeing, what we're seeing, and where we have a lot of business. I do ask all our beneficiaries continue to use TRICARE Online, secure messaging, please, with our providers. They remain available to you for telecons, TCONs, and however we may best serve you. And we can certainly look for other options if there's another way we could meet your need. We look for your ideas in that manner too. One other question here related to pharmacy. What about controlled prescriptions? Remains the same. We have documentation that you'll need to sign if for whatever reason for a new prescription, if it's controlled, and you do come around and park and endeavor to wait while we fill that. We have some documentation that you will need to sign. We'll do that through your window for us to ensure it's not only patient education, but acknowledgement of the substance with which you are receiving. And it's our accountability process with which we need to maintain for our records. Again, those are for controlled prescriptions. Great question for there. With that, I stand ready to answer any other questions you may have, and sir, back to you.
Well, I do have a question for you.
Okay.
So what I think I heard you say is that unlike a lot of the stores around the Tennessee Valley that are having difficulty maintaining stocks, I think I heard you say that the pharmacy has plenty of individual prescriptions in stock, and you actually need people to show up and
Yes.
pick up their prescriptions.
That's a great point. Thanks for bringing that up. We do ask that if you've called in refills for your prescriptions, please do come by and pick them up. 2 days ago, we were at 99% max capacity of our storage space. When I closed out with one of my pharmacists at the end of the day, she had good news. She said, "Sir, we're down to 90% of our capacity storage." And I said, "Well, that is good news. We just need more of our patrons to come by and pick up their prescriptions." I'm happy to report the process has gotten a lot better, pretty streamlined. So I think you'll find a pretty quick turn depending on what time you come through over at the pharmacy. But to your point, sir, we do. Stocks are fine. Our shipments have not wavered at all for our daily or our weekly shipments of pharmaceuticals. So that will not be an issue for you, not in stock per se. But yeah, that's a great point. Please do come on by. We look forward to seeing you as always and pick up your refills.
All right, great. And I'll tell you, so I walked into the commissary on my daily walkabouts yesterday, and our supply lines at the commissary as well as in our local stores are beginning to get better as all of us adjust to the new normal, and our deliveries are becoming more consistent. So yesterday, I actually saw paper products on the shelves at Redstone commissary. I noticed that the meat aisles or the meat coolers are well stocked. We have plenty of frozens. The stocks are returning to normal. What I would caution each of us with and ask you to help us with is, at this point, I'm fairly certain everybody has a pretty good stock of paper products at the house because it's not on our shelves. So what I would ask people to do is to ensure that as you come in to use our commissary is buy what you need. That will allow us to restock our shelves and continue to have it available for you in the future so that we don't need to stockpile. I'll tell you that that's how each one of us can help each other out is let's buy what we need and it'll allow us to restock. Now, I did notice on the texting conversation here on the side of Facebook is a difference of how we are observing, how each person is observing what they see in the commissary, the PX, and Fox. And I can assure you that the employees at the commissary as well as at the PX have been issued gloves and masks to use when they are within 6 feet of social distance of each other or of you. And I can tell you that at the PX, we have installed what would otherwise be termed as spit guards. At the VCC, we've done the same thing as we've put up plexiglass shields. That is more difficult in the commissary. However, I can tell you that Mr. Somerville and the DECA staff are working to install those as well. But there is no precaution that we are not exploring the feasibility and the acceptability of, and as we can make those available and as it's prudent, we will put those precautions in place. Now, to give you another discussion regarding the commissary and a couple other topics, I'm going to turn it over to Sergeant Major real quick.
Good morning, Team Redstone, families, friends. I got a question, a couple of comments here before I pass it back over to our commander. One of the questions that came in is, why is Reveille and Retreat no longer playing? I live here on the installation and do not hear it anymore. That's a great question. You are right. The Arsenal has temporarily paused the detail to ensure that the safety of our soldiers that conduct that tradition of raising and lowering and folding the flag. We're looking at that to ensure that social distancing, and we're doing our part to ensure that they're safe as well. So as of now, the flag will be flown 24/7 until we pick up that detail again. As we continue to do our part to social distance and place measures to protect, our force, I ask our viewers to continue to help out and fight this COVID-19 by continuing to do the great job that you guys are doing already, and that's to adhere to the CDC guidelines. And that's social distancing, continue to wash your hands, avoid touching your eyes, your nose, and clean, disinfected frequent areas that are touched. And if you're sick, stay home. One comment that I want to put out that as of Friday, 10 April, the commissary and PX for our patrons, they will be required to wear a cloth face covering or a mask to come into the PX and commissary. And that's just to protect all our patrons and all our customers coming in. One of the last comments that I wanted to put out is I want to make our community aware of any potential scammers and cyber criminals out there. Please, be careful of what's being pushed out there in the social media, because they are reaching out to you via email, social media, telephone calls, pretending to offer services, vaccines, recovery methods, or protection with upfront fees. And they could be pulling for your information as well. And that's something that we want to avoid with our team here in Redstone and with the community out there. With that said, back to you, sir.
All right. Hey, so there was a topic that brought up in the right-hand bar there, and that is it really gets down to how do we determine what mission essential is. From the Garrison standpoint, mission essential is relatively easy to determine. It is that individual, because we're customer service, it is that individual that integrates or works directly with delivering a service or a benefit. It's very easy at Redstone and on the Garrison staff to determine who's mission essential, because largely it determines who is interacting directly with you. Policemen, firemen, healthcare personnel. That's very easy to determine. However, I want to reach out to Craig and a few other people that are out there and just assure you that the tenants here on Redstone Arsenal, those that have been deemed mission essential, they are working behind the scenes to support our soldiers forward. And if you look up at what the nation is doing to combat COVID-19 in New York and in other places that affected more severely around the world, I can tell you that our program executive offices, our Space and Missile Defense Center, and Army Material Command have their hands heavily in how our nation is reacting to help other portions of the country combat COVID-19. While Garrison is easy to determine and easy to see how our personnel are essential to continuing to run the installation, I need to assure all of you that your tenant leadership and the Garrison tenant or the Redstone Arsenal tenant leadership are looking very, very keenly at who is mission essential, not just to Redstone Arsenal, but to our nation and to what they are providing elsewhere. We have continued to reduce the footprint here so that we can enable social distancing for the workforce. But at the same time, the missions that Redstone Arsenal and our tenants are performing are certainly contributing to what is going on statewide, what is happening nationally, and what is happening globally. Army Material Command has a huge reach. Their logistics capability is second to none, and the materials and supplies we are pushing all over our nation to combat COVID-19 are largely enabled and facilitated by what is done here at Redstone Arsenal. Now, before I move on to a couple other questions, I'm going to pass it back over to Colonel Meador and answer another Health Center question.
Okay, thank you. Had a great question here on just a second ago about timing of prescriptions and when to pick up prescriptions. For us, we do ask that when you call in or have a provider call in a prescription for you, or you use during the day between 8 a.m. and 6 p.m. TRICARE Online, do build in a 72-hour turnaround window for that. I think it's safe on your part to assume the prescription has been received. And I will tell you that in any scenario where you arrive for your pickup and there is an issue or a concern, it will be rectified on the spot. The worst thing that's going to happen is we're going to ask you to pull around and park while we get that issue worked out for you. You're not going to leave without your medication, especially when you've called it in in an appropriate amount of time. What I would ask you to do for everyone out there is to anticipate your usage. We have had some scenarios where, and we all forget, we're all human, on our prescriptions where we get down pretty low and we don't anticipate that 72 hours that we need at Fox to refill your prescription, and it becomes a bit of a dire situation on the part of the customer. So do anticipate your usage when you start getting low on your medications. Do build that into your timeline of when to call it in. We ask for the 72-hour turnaround to fill your prescription and get you on in there. And one last plug-in. If you've called a prescription already, please come by and pick that up. Again, our space is limited on storage, and we look forward to seeing you. Thank you.
All right. Thank you, buddy. Okay, I'll get on to a couple other additional questions. I just noticed that there was a question about will CDC fees be prorated for those individuals who currently are teleworking and or are staying at home and are not using it. Yes, we do absolutely realize that you've already paid for your CDC services, and we understand that that you aren't currently using them. My MWR staff and the CDC have assured me that rather than to give you a refund, what we will be doing is applying those credit hours to your child's care at the conclusion of the COVID-19, and when we are able to return to providing that care for your children, we will credit your account so that you can continue to avail yourself of the CDC services with dollars that you've already paid. Please check with the MWR CDC staff, and they'll be able to explain that specifically to you. The next question kind of covers a lot of questions. And it says, with the statewide stay-at-home order, has the status of Redstone changed? That's question one. Question two, I'm a service-disabled veteran and would like to use the PX and commissary. Can I still access the installation? So let's deal with access first. We'll deal with the stay-at-home order first. I'm sorry. So Redstone Arsenal, as you know, has been adjusting the precautions that we've taken to be commensurate or to fit the same intent that our city, our county, and our state have been doing. All of our intents, the leadership here at Redstone Arsenal, is to continue to reduce the number of personnel that are required to be in at installation, to reduce the individual contacts that each one of us have each day. And if we reduce the number of contacts, then we reduce the possibility of spread of this virus. Redstone has continued to reduce that. We have closed all of our dining facilities and done takeout only in order to reduce the amount of times we all come in contact. We have closed those areas where people come into contact all the time. Sergeant Major talked about us not performing reveille and retreat anymore. Those are all, while they are Army traditions, those are opportunities for people to come together and potentially not just share their social enjoyment, but to socially share the virus. So we have suspended those practices, much like we've suspended golfing. And I realize that golfing is an outdoor sport, but we do golf in groups. And so at this point in time, we're continuing to suspend golf. And I look forward to opening the links just as well. There are places that are still open. You'll notice that if you have normal access to Redstone Arsenal, there's biking still on the weekends or on the weekdays. You're free to use the roads, and we just encourage you to do so on an individual basis or in small groups. Likewise, the trails are still open. There are some places that we have closed. I know I've answered many questions about turkey season, and it's not that hunting isn't an individual sport, but the number of personnel we have to bring in and put in contact with one another in order to safely allow us to participate in those activities causes us to bring more people together. And until we can bring more people together safely, we're still going to have to suspend those kinds of activities. Not necessarily because the activity itself isn't solitary, but because of the workforce we have to bring together in order to continue to provide that service. The stay-at-home order, you'll notice that we have reduced some services due to the stay-at-home order. It's our assumption that the stay-at-home order, or it's our interpretation that the stay-at-home order asks each and every one of us to not go out of our homes or not participate in an event if it's not essential. Essential is going grocery shopping. Essential is going to the doctor. Essential is coming to work. But there are those things that are no longer essential. If you are at home teleworking, then it doesn't make much sense to drive on to the arsenal to deliver your child to the CDC and then return home. That is just an unnecessary drive. And as your tenant commands have put us all out on telework, we've also understood that there's going to be a relaxation of how we go about doing telework. And therefore, we don't want to draw you onto the arsenal to drop off your child at our CDC. And so today, the CDC is mission essential only. Only those people who have to come onto the arsenal are encouraged to use the CDC. We talked about considering MWR as far as opening the links. And yes, we want to open it as soon as we can. But right now, we're going to continue to support the state of Alabama, and we're going to continue to support the stay-at-home orders. I'm going to turn it over to Sergeant Major. He's got a question he had thrown at him, and so I'll prepare my next question.
Sergeant Major here. I just wanted to clarify some of the comments that were going on the Facebook. So on Redstone Arsenal, we are still practicing social distancing, and if you cannot get that spacing in between, then we ask you to put on a cloth cover or a mask. The PX and commissary has taken it a step further, and they are asking that patrons coming in wear a mask or a cloth cover. Some examples of a cloth cover is like a scarf or a gaiter for the military, or a bandana, as long as it can cover the nose and mouth area down to the chin. So that's what we're looking at to ensure that we clear some of those comments, and I wanted to just make that statement. Thank you.
All right. So there was a question in there, and Lex, I did see your note. Hey, I don't even get to the woods. I barely get off the tee box. But the unfortunate part is there's still a large group of people that have to run the golf shop, have to run the pro shop, and have to come together to tend those grounds. And we bring a lot of people together just to make that happen. So unfortunately, golf is not something we're going to be able to support in the near future. The next question is, what about EAP services? And I'll tell you, so EAP service, CAC ID, all of those services that Redstone Arsenal has always provided directly to the individuals to improve their, or to make them able to work on the installation, or to provide services to support their employment. All of those services are open. They are by appointment. I ask you to consult our Team Redstone website. We have a broad list of what services have been suspended as far as walk-ins, but we have our points of contact listed there for you to contact and make an appointment should you need EAP services, CAC ID, finance, transportation. All of the services are currently being provided. Our employees are just providing them from telework, and if we need to schedule a face-to-face appointment, we're happy to do so, or we'll bring you up on Zoom or another teleconferencing capability so we can have that face-to-face meeting and still be able to process your requirements. The other question I did have, and I lost, it's a new one. This is the first time I've seen this question. And has RSA considered allowing drivers to leave their windows up as they come through the gate to provide an extra barrier between the driver and the guard? So I'll tell you, up until I had that question, that's not something we had considered. One of the ways, or the ways that both Colonel Meador and myself, as well as the other tenant leaders, is how we make decisions or how we come up with recommendations that we believe should be implemented. It's very important to understand how we go about doing that. And first, it is to evaluate the threat that we see that COVID-19 poses to all of us. And then to look at the methods that we have available to us to employ to limit that threat. Many of the precautions that we see today isn't in an abundance of caution. Whether that is a stay-at-home order, or whether that is wearing a mask or wearing gloves, whether we put up spit shields between a customer and an employee, those precautions we believe are prudent. There are many, many, many things that we could continue to do. The question is whether they are prudent or necessary. And while I will tell you we haven't studied this, we do believe that for your protection, your safety and security here on the Arsenal, it is still necessary for the guard to be able to clearly identify the individual. They may ask you to pull down your mask if you're wearing it, to clearly be able to see your picture on your ID, and to be able to see the expiration dates. To put a barrier, to continue to put further barriers between a guard and a driver potentially creates a vulnerability for each and every one of us, not to COVID-19, but to our threat of our security. And so while I will tell you that I will take this into account, and I'll certainly look at it, we believe, both Fox and Redstone Arsenal and the leadership here believe that we have already taken prudent steps that are justified to continue to protect us. There are many things that we could do that we have yet to implement, and we hope that we never have to continue to protect you, both your safety and security, and to protect you from the virus. But I assure you that we take the most prudent steps and the ones that seem to make sense. I haven't seen a whole bunch more questions. Oh, here comes Julie delivering another one. Just a minute. The question is, what is EAP? EAP is Employee Employee Assistance Program. It's a broad range of services that we provide to employees, whether it's behavioral health consultations or policy understandings. Plenty of employee services. I urge you to contact the EAP office, and we can walk you through a broad range if you feel you need the assistance. I did get a question: is the exchange doing a mandatory mask in order to enter again? Also, so I've talked with Teresa Pelu, our AFES manager here, as well as Mr. Somerville, Sam Somerville, the commissary manager, and we just received the directive this morning. So immediately following this town hall, I'm going to actually go sit down with both of those individuals, and we at Redstone, for the facility that includes both the commissary and the PX, we will ask you not necessarily to wear a mask, but to wear a cloth face covering in order to enter that facility. And that's for the protection of all of us. And again, that will take effect, as Sergeant Major said, on Friday. Once again, the Army isn't going to issue all of us the mask to do that. That's our own personal responsibility. In order to use that benefit, you'll have to come with a cloth face covering or a mask, and that's at your expense. And do we have any other questions out there, Julie? Well, then, she's delivering me one. We have one more coming. Buddy, do you have anything you'd like to hit?
So.
Okay. So yes, I am aware that, so the comment came in that Zoom isn't allowed on some of the Army networks or some of the federal networks that all of us use. However, we as Americans are ingenious fellows. There are plenty of other video teleconferencing sites out there. If you call in to us and we'd like to have a face-to-face, or you'd like to have a face-to-face appointment, and we can't do that physically, I assure you that between you and the customer service representative, we can identify a suitable means or medium for us to be able to communicate over. And if that's just the telephone, well, we'll work the telephone. But dependent on what your system is capable of and what our system is, we will find the way to meet in order for us to answer your questions. So I'm going to tell you that I appreciate everybody's participation, both Colonel Meador, myself, and Sergeant Major. We welcome the opportunity to answer your questions. We certainly welcome the opportunity to continue to communicate to you that Redstone Arsenal, Team Redstone, and all the tenant leaders here have your best interest and the Army's best interest at mind. We know that we have to protect you so that you can protect our nation. We have taken many precautions to, one, protect you, as well as to ensure that Redstone Arsenal is encouraging you to abide by the state's stay-at-home order. And we have limited the opportunity for us as individuals to socially gather. The question really comes down to each of us is, are we doing our part personally to ensure that we are following the stay-at-home order and we are socially distancing and we are maintaining the best personal hygiene? That is the best way to fight COVID-19. And I'm happy to say that here in the Tennessee Valley, here in Alabama, we have taken some very positive steps forward. And we and the rest of the nation, if we continue our fight, we will win. And I encourage each one of you to continue the fight personally, hold yourself accountable, and thank you very much for helping us protect Redstone Arsenal and protect our workforce. Anything from you, buddy?
Oh, look forward to seeing you all at Fox Army Health Center again tomorrow. Our new pharmacy services for new refills begins, or new prescriptions begins. And stay safe out there. And as Colonel Smith mentioned, ensure all the social distancing measures you're taking into account for all your goings out to whether grocery store or coming on into work. Thank you.
All right, Sergeant Major.
T. Redstone, I just want to say thank you for tuning in as we continue to push out information and keep you guys informed. Thank you for all your great leadership that you're doing out there and helping us get through this together. We will fight this and get through this. Thank you.
All right, Team Redstone. Have a great day. Thank you all very much. And stay safe.